Today, my thoughts are with every patient battling the Ebola outbreak in the Democratic Republic of Congo and Uganda. But they are also with the millions of others, quietly fighting chronic diseases, cancer, HIV, tuberculosis, diabetes, hypertension, mental illness, etc., whose suffering often goes unnoticed in the affected areas. When an outbreak strikes, a silent crisis unfolds in its shadow. Patients living with chronic diseases lose access to the care they depend on. This disruption is one of the most overlooked consequences of any epidemic, especially in countries where healthcare resources are already stretched thin. The reasons are twofold. Patients stay away from clinics, afraid of getting infected. And health systems, overwhelmed by the emergency, redirect all their attention and resources to fighting the outbreak. The chronically ill are thus left behind. This is a parallel emergency. It deserves the same urgency, the same resources, and the same level of attention as the outbreak itself. Yet chronic disease specialists are largely absent from the national and international response teams deployed in affected areas. That must change. These patients face a double burden. They must maintain their treatment without interruption or risk their condition spiraling out of control. At the same time, their underlying health conditions make them far more vulnerable to the outbreak itself. They are fighting on two fronts at once. This is not a new phenomenon. Research from the International Agency for Cancer Research, led by Dr. Eileen Morgan and colleagues, has shown that the COVID-19 pandemic severely disrupted access to care for cancer patients in several countries. We cannot afford to repeat the same mistake. The time for action is now. I call on all international health organizations and partners to formally integrate chronic disease management into every outbreak response framework. Not as an afterthought, but as a core pillar. Every response team deployed to an affected area must include chronic disease experts. A dual response mandate, one that fights the outbreak and safeguards the chronically ill simultaneously, must become the new global standard. Saving lives also implies not choosing which lives to save. Each life matters. Did you hear Joseph's medical story? Check this out. Every morning for 6 years, Joseph Kamara swallowed 2 small tablets and went to work. Blood pressure. Heart rhythm. Ordinary as sunrise, until Ebola arrived. Within weeks, the clinic's chronic disease room was shuttered. Nurses redeployed. The pharmacy window closed. A handwritten sign read, "Routine consultations suspended." Joseph rationed what remained in his blister pack. Half a tablet some days. Nothing on others. His ankles swelled. At night, his heart stuttered. His family sold their motorcycle to pay for a private consultation. The doctor's face said everything before her words did. Not irreversible. But close. Joseph's story is not rare. Across every outbreak, thousands of people with diabetes, hypertension, HIV, and asthma deteriorate quietly in the shadow of the declared emergency, not from the virus, but from the silence it creates around everything else. Outbreak response must protect everyone. Medication supply chains, community dispensing, and chronic disease follow-up must be built into emergency plans from day one, because a response that saves lives from one disease while abandoning another is not a complete response. It is an incomplete one. And the gap costs lives. Do you think that it matters to raise awareness about this vital concern? Share to contribute to saving more lives. Express your thoughts in comment. Drop your suggestions inbox to improve health. Help is on the way. Hope is on the way. Health is on the way. And that, for everyone, every time, everywhere. Join this life-saving journey and let's make the world healthier again.